It's nice to see you.
Good morning.
Deborah, thanks for coming on the show to share your story. Well, you always have good news, good news when you come on the show, which is exciting. So I want to start with some of the medical terms that our audience may have heard of and associated in the past. Let's start with that.
Yeah, the names people typically hear will be complex regional pain syndrome or sympathetic mediated pain or reflex sympathetic dystrophy. Sometimes people call that RSD, and those are the terms that you'll hear about oftentimes.
What causes someone to have chronic pain?
Trauma, just something as simple as an ankle sprain, Denise, could cause it. Somebody may drop a frozen turkey on their foot and injure their foot in that way. They could injure the nerves in that way, and sometimes surgery.
You kind of chuckled when you said a frozen turkey, but that happened to my brother. It
really
did. It was craziness. But I want to read a list to you that I have here in front of me of what other doctors have told patients, and then I want to get your opinion afterwards. Okay, so a doctor has said the surgery went perfectly, but, or it's all in your head, which has been told to several patients I've heard on this show before. Your symptoms are out of proportion to your injury, or how about this one? You're only looking for more drugs. What's your response to those?
Well, they're typical things I hear in our clinics, and it's frustrating. I think something I want to emphasize, doctors want to help people, and I think sometimes they're frustrated with the patients because they don't know what to do, and sometimes they're confused about what the diagnosis really is, and that's where we come into play. So it's something that you'll hear quite a bit, and it's difficult. So
let's talk about what you hear quite a bit too, and this is good because a list of what patients have told you, they say, I don't want to take drugs anymore. Okay. Another one, I want to return to work. How about I don't want to be depressed, and that's so true. And no one believes me. Going back to it's all in your head.
That's exactly.
What do you say to that, doctor?
Well, again, I have to tell the audience out there, listen, I mean, you're not crazy. I mean, because that's what people begin to think. They question themselves because they've been to an authority. Maybe they've been to a doctor and they start questioning themselves. And they are right. They are in pain. And I think healthcare providers oftentimes don't understand the amount of pain they're going through. And these patients become kind of grouchy with themselves and everybody around them. And it's very stressful for them.
Can be stressful to the patient, but to also the family members, like you said.
Their spouse, whomever.
So Dr. Anderson can help you with chronic pain, 1-800-866-4620. Tell me about some of the approaches that have been used in the past to treat.
The real standard things that you're going to hear about would be using pain medications. There's different medications that you can take. They don't really necessarily fix the problem, but they may address the pain. Sometimes nerve blocks in the spinal cord, or maybe even spinal cord stimulators. That's another way to approach the problem. And that's been kind of the mainstream way of doing or helping with these patients.
So you actually give them their life back. You don't just mask it with drugs. This is helping someone that's been suffering from chronic pain for quite some time. We're going to show a picture here, and I just want to give you a little warning. It's pretty intense. It shows nerve surgery. So heads up, but this is what he deals with day in and day out. Tell me what we're seeing here, doctor.
Well, this is just an example of a lower leg where a patient had a really bad ankle sprain and it kind of yanked at a nerve, and then the nerve scarred down. And this is an example of where we would remove the nerve. We actually remove the nerve, and we call it desensitizing the foot and ankle so they don't have their pain. But that was the source of their chronic pain, was this nerve being stretched.
See? Wasn't just in your head, was it?
Exactly. So these nerves, if they're traumatized, they tend to scar down from surgeries or from injuries, and nerves need to move. And if a joint moves, the nerve's got to move with it. But if it's scarred down, it can't move. It's kind of stuck, and it's pulled on, yanked on, and it hurts. It causes chronic pain.
So the big question I think everyone at home is probably saying to themselves, well, what is he doing that's different? The
thing that we do that's different is, and I call it mapping. Patients come in, and we find out where their pain is generating from. We call it the pain-generating area or pain-generating nerve. We try to localize, and I can usually do this just clinically by examining the patient, try to find the nerve or nerves that are causing their chronic pain. And then oftentimes we have to use injections, and maybe we have to do it more than once. But we use these injections, and these injections are just simple local anesthetic injections to numb up the area, and then we see how the patient responds. And then we can localize where their pain is coming from. And then we either, in some cases, have to remove the nerve, or sometimes have to dissect away the scarring that's on the nerve. And that's how we help with these people. But it's not it's not this regional pain thing. It's a localized nerve that's the source of the problem. Once we take care of it, the pain is gone.
So it's been pretty successful for you and the patient.
Very rewarding. And we do these surgeries. People can walk immediately afterwards, and oftentimes the next day or at their first post-op visit, they can tell the difference immediately.
Wow.
So.
That is a huge, huge difference. And you can see at the bottom of your screen right now, complimentary consultation free. Is that what you're offering our viewers today?
Exactly. It's a free initial visit at any of our locations.
Great. Excellent. We're going to give you that that phone number here in just a few moments. But that normally is what,
$145? Yes, exactly.
Saving.
Yeah.
Wow. And if people are at home thinking, I've been suffering with this for so long, they're going to jump on that. So call 1-800-866-4620. Tell me more about Deborah. I know you're a Colorado and Company viewer. When I walked in, you said, I love this show, which thank you, by the way. Yeah. But why did you decide to go see Dr. Anderson?
Well, I was putting up Christmas lights, and the ladder slipped, and I came crashing down on my ankle and broke my ankle, and I guess it caused some nerve damage. And the doctor, I had quite a bit of pain, and the doctor told me, well, this is as good as it gets.
Still? So you're left with all that pain?
Yeah.
And that's a different doctor?
Yeah, that was a different doctor. And so I was referred to a pain clinic. And so I went to the pain clinic. They gave me narcotics, and they were putting me through spinal injections. And their ultimate goal was to give me a spinal implant to numb the pain.
Oh my God!
And while I was on these,
for a broken, I'm sorry. Let's go back. You broke your ankle?
Yeah, I broke my ankle.
And they wanted to mess with your spine?
Yeah, yeah, because that's the traditional treatment for the RSD.
She'd had some surgery, and the surgery injured a nerve. Is basically what had happened, and it can happen with any surgery. It can happen, and so there's some scarring on the nerve.
Right.
Oh, and so what happened when you went to see Dr. Anderson?
Well, I was amazed. I'd been to so many doctors, and when he saw me, he knew what my problem was, and that was amazing, because so many doctors didn't want to do anything for me, or couldn't, you know, and all they could give me was the narcotics. Yeah. So he saw me, and boy, that was great.
And,
I knew what the problem was.
Yeah, how can you drive around and work and deal with kids when you're on narcotics all the time? You can't do that.
Oh, it was awful. I'd sit down, fall asleep. I'd go to bed at 7 at night. You know, and the pain, it's undescribable. It never stops. Yeah, just a chronic throbbing.
Are you pain-free now?
I'm totally pain-free. I was pain-free right after his surgery.
Well, tell me what you did for Deborah.
Yeah.
Well, she had, on the outside of her ankle, she'd had a broken heel, and oftentimes you have to go in and fixate that. You have to put some plates in and put the heel bone back together, but in the course of that, a nerve had been injured, and I basically just removed the nerve. I went up a little bit above the ankle, and it's a nerve that doesn't innervate any muscles, so she's not paralyzed or anything. You're just removing a nerve that supplied sensation there, and then we bury the tip of that nerve into some muscle so the tip doesn't bother her. And away you go. It's pretty much just removing the nerve. And again, she was kind of doubtful at first, but we did these injections, and she kind of went back and forth about 3 times, injecting her, and then she would kind of doubt, and it took a little bit of while to earn her trust, but the injections kind of would prove to her that this was going to work.
Because other doctors had told me they wouldn't do any more surgery because it would make it worse.
Oh, well, they were wrong.